welcome again. Thanks for joining us for Closing the Loop for Lupus, a wellness toolkit for women. I'm Katie Schubert. I'm president and CEO of the Society for Women's Health Research. SWHR is the thought leader in promoting research on biological sex differences in disease and improving women's health through science, policy, and education. Lupus is an autoimmune disease that causes widespread inflammation that can affect almost any part of the body, but most commonly affects the joints, skin, brain, heart, and kidneys. Because there is no cure for lupus, treatments primarily focus on reducing symptom flares, which can limit the positive health outcomes for patients, 90% of whom are women between the ages of 15 and 44. Lupus can present significant challenges to daily living, including managing work and school life and relationships. However, with a proper diagnosis and treatment regimen, symptoms can be stabilized and even improve over time. Today, we welcome three amazing panelists who will share their expertise about lupus and women's health. Dr. Anka Askanase, Professor of Medicine at Columbia University, Dr. Rosalind Ramsey Goldman, Professor of Medicine at Northwestern University Feinberg School of Medicine, and Estela Mata-Carcamo, President of Looms for Lupus. I'd also like to thank the sponsors of today's event, Eli Lilly and Company and Aurinia Pharmaceuticals. SWHR maintains editorial control and independence over our program development, content, and work products. And as always, we are live tweeting during this event. We invite you to join us and use the hashtags SWHR Talks Lupus and hashtag SWHR Talks Autoimmune on all social media channels. And at this time, I'd like to introduce SWHR's Chief Science Officer, Dr. Irina Ninye, who is moderating today's event.
Thank you, Katie, and welcome everyone. It is estimated that 1.5 million Americans have some form of lupus. Systemic lupus erythematosus is the most common type of lupus affecting multiple parts of the body, whereas cutaneous lupus erythematosus primarily affects the skin. Like Katie mentioned, 90% of lupus patients are women, and these women have an increased risk for developing other health conditions such as heart disease, osteoporosis, or lupus nephritis. SWHR's lupus program was established to increase awareness and address the disproportionate impact of lupus on women's health across the lifespan. We have assembled a working group of researchers and healthcare providers with expertise in rheumatology and immunology, as well as patients and patient advocates and healthcare decision makers who are committed to improving care for women living with lupus. With the guidance of the experts in our lupus working group, SWHR has developed a patient toolkit to help women living with lupus navigate their care. Raising awareness and improving access to information about this disease can help to reduce stigma surrounding lupus and better prepare women and their healthcare providers to address potential challenges throughout their life course and maintain their health and highest quality of life. Today, three members of the working group are joining us to highlight information found in the toolkit and share their insights as to how we can better understand lupus, recognize the symptoms, and manage care for patients and loved ones living with lupus. This conversation will build on our fireside chat last month that highlighted patient perspectives and helpful tools for living well with lupus. If you missed that webinar, a link to the recording on the SWHR website is posted in the Zoom chat. Following the speaker presentations, I will be moderating a discussion with all of our panelists, so we invite you to use the Q&A function to submit questions throughout the event. Please note that our resources and conversation today are intended for educational purposes and are not intended or implied to serve as a substitute for medical or professional advice. We encourage all patients and consumers to confirm information and consult their healthcare provider to determine their individual needs. Now, I will introduce Dr. Anka Askanase, who will start us off with an introduction to autoimmune diseases and understanding the risk factors and common symptoms of lupus. Thanks for joining us.
Thank you. It's such a pleasure to be here, and I am actually quite excited about I'm very excited about the project. I think this toolkit that we put together with the work from Society for Women's Health Research is actually an important achievement, since a lot of this information has been gathered in one place, allowing people with lupus to use this as a reference for a lot of questions You can do your own Google research, but I think that this is the first time where an expert panel put together all these data to help navigate lupus. Next slide. So autoimmune diseases are inflammatory diseases where a person's immune system mistakenly attacks their own body, their own healthy tissues. The immune system's job is to keep us healthy. How does it do that? It recognizes microscopic foreign material as it enters the body, such as pollen that may be responsible for allergies, or bacteria or viruses that might be responsible for, say, pneumonia or COVID. It produces proteins called antibodies that target this foreign material. And in doing so, it restores health. Once the infection is controlled, the immune system stops and your health is restored. Well, in lupus, the immune system cannot tell the difference between the invaders and your own cells. It malfunctions and wrongly attacks healthy tissues. This leads to the development of immune-mediated inflammatory diseases that cause inflammation and internal damage in any part of the kidney. Autoimmune diseases are a subset of these immune-mediated inflammatory diseases in which the anti-self antibody are responsible for the immune response. So that gets us to a whole bunch of immune conditions like alopecia areata, multiple sclerosis, psoriasis and psoriatic arthritis, rheumatoid arthritis, Sjogren's, thyroid disease, and of course, lupus. Now, it turns out that the majority of these autoimmune diseases are more common in women. 4 out of 5 people diagnosed with autoimmune diseases are women. Well, lucky us. Well, obviously, lucky in quotes. So, understanding the risks helps us better diagnose them. Next slide. I think that both Irene and Carolyn talked about lupus as more of a group of diseases as opposed to just one disease. There are people that have systemic lupus where the immune system attacks multiple parts of the body. Cutaneous lupus, where the immune attack is only directed against the skin. Drug-induced lupus, that's a version of lupus where the trigger of those anti-self antibodies are actually medications that we take for other conditions. Neonatal lupus, that's a very interesting type of lupus where the antibodies cross the placenta. While the woman is pregnant, the antibodies cross the placenta and can injure the baby's heart. And then incomplete lupus. Incomplete lupus is people with lupus, but they don't meet the classification criteria for lupus. It does not mean that they're suffering any less. It just means that in terms of the way we think about making a diagnosis of lupus, which is, observing sort of predetermined criteria about how to make that diagnosis, they might miss one of those criteria in order to make it complete lupus. Now, what we've learned over the past 2 decades is that the immune dysregulation in lupus does not happen right away. It's not an immediate turn-on process. It accumulates over time. First, your body starts making these bad antibodies. Then some symptoms occur, and then ultimately more symptoms accumulate and clinical systemic lupus becomes apparent. So it's a process. Some of those people with incomplete lupus may be evolving, and some of them, we tend to call them pre-lupus, as in things may be happening, and as we're learning about this, we may be in a wonderful situation where we can intervene and make a difference, prevent lupus. I think it's already been said that 90% of people with lupus are women between the ages of 15 and 44. So it's at their peak of their lives. Women suffer from this disease. Next slide. So what causes lupus? Well, it's a really good question. And, some years ago, I thought that I was going to be the one to discover what causes lupus. But, since that eluded us for some time, and it probably will for a while, we now have learned very clearly that there are many pieces that need to come together for lupus to ensue. So there are genetic factors, which are very important. A lot of women with lupus and a lot of people with lupus have a family history of lupus, either a first degree relative or someone else in their family that has lupus. So genetic factors are important, but they're not everything. Even in identical twins, it's only about 50% of them that are concordant for lupus, meaning they have lupus. Both of the twins have lupus. So clearly something else is needed to trigger. And we think that may be an environmental factor. So what is that environmental factor? More work needs to be, a lot more work is needed before we can come up with a very clear understanding as to what that environmental factor is. And we'll talk about that in a minute, try to better understand what pieces of the environment may be responsible for triggering lupus. So we already said that it's mostly a disease of young women between ages of 15 and 44, but it is also a disease where African American and Hispanic women are 3 to 4 times more likely to develop lupus than white women. Additionally, it is the same groups of people that have more severe early onset, more organ involvement due to lupus. The diagnosis of another autoimmune disease increases the risk. So sex and age, race, family history, and another autoimmune disease are all risk factors. Next slide. So we've said that lupus is a disease where any part of the body can be affected. Let's just focus now over some of the more common symptoms of lupus. And you will note that those symptoms span the body. It's not just, it's not just symptoms of skin involvement or joints, it's symptoms across the body. So fatigue across many surveys and many research projects seems to be the most common, most overwhelming, and most devastating symptom of lupus. This is not, I didn't sleep last night, ergo I'm tired. It's an overwhelming tiredness, much like you would feel when you have a bad case of the flu, or when some of you may have felt when they had COVID. Then joint symptoms, pain or swelling in the joints, skin problems, the famous butterfly rash on the cheeks and the nose, but also sensitivity to sunlight and fluorescent light. So skin manifestations, including sores in the mouth and the nose. Headaches are common in people with lupus, hair loss, low-grade fever, but some other people have more organ involvement and they might come in with chest pain, trouble breathing, leg swelling, or brain fog, or more clear neurological symptoms like weakness, inability to get out of a chair. Some other patients might have what's called Raynaud's, where their fingers turn dead white in the cold. Next. So what triggers lupus? And I think that we talked about it for a little bit, but these are some triggers that can cause flares. Stress, both emotional and physical, exhaustion, an infection or an injury, changes in the medications, exposure to sun or ultraviolet light, certain medications like hormone therapy, and then changes in estrogen levels. Lupus is a disease of young women. It tends to happen that the onset is, at the time of the first period. So as estrogen starts to build up in the body, that is the time when lupus may happen. Next slide. So getting back to that, about 1 in 5 people who have lupus develop it in childhood. So hormones such as estrogen that regulate many of the body's function have an impact on lupus symptom and severity. Now you would say, well, what happens when a woman is pregnant? Well, it is pregnancy and delivery of healthy babies are possible in people with lupus, but this should be a planned event. One should not embark, on a pregnancy unless their disease is controlled. So this is a situation where the patient and the doctor need to work together to identify the best time for pregnancy. And then a high-risk obstetrician should monitor potential complications such as preeclampsia, diabetes, and preterm delivery. Now, interesting enough, because estrogen is a big player in lupus, as it starts in adolescence, it tends to get better after menopause. And a lot of women experience a decrease in their symptoms and flares after menopause. That doesn't mean that after menopause women can get lupus, but for some women after menopause, their symptoms get better. And with that, I'm gonna invite the next speaker.
Thank you, Anka. Next, we'll have Dr. Rosalind Ramsey Goldman, who's going to discuss diagnosis and treatment approaches to caring for women that are living with lupus.
Thank you. Thank you to the Society for Women's Health Research for this opportunity to meet with you today. Dr. Askaneh did a wonderful introduction, and I'm going to emphasize some of the concepts that she mentioned when we talk more specifically about diagnosis and management. I too am very excited to share this information with you. We want to empower you so that you will be able to partner with your healthcare providers and your caregivers so that you have a voice in diagnosis and treatment of lupus. So I'm going to cover a few of the topics that are in the Wellness Toolkit, but I also look forward to your questions and comments to explore some of this material in more depth. Next slide, please. So, as was mentioned earlier, a diagnosis of lupus is not so easy to make. In fact, it can be quite challenging. And if you remember on those list of lupus symptoms, many of those symptoms, and particularly, let's say, joint pain and fatigue, are similar to other rheumatic diseases, such as rheumatoid arthritis or fibromyalgia. Some of those symptoms that were listed could also be present in non-rheumatic autoimmune diseases. If there was a problem with your thyroid gland, you might be fatigued. And if there were low blood counts, you might have had problems with let's say anemia or your platelets, which might increase your risk of bleeding. So it's really important to think about these symptoms. And part of the challenge is that some of these things happen over time. So let's say you're really tired one time and you see a provider, they may just treat that one symptom. Another time you might have a swollen joint, or another time they might notice that one of your blood counts is too low, but everybody is just focusing on one problem. But over time, you may have multiple things, and the journey to the diagnosis, in order to put all of this together, might take up to 4 years from the time you had your first symptom till somebody recognizes that you have lupus. And you might have seen several different providers. You might have to see 4 or more providers before you get this accurate diagnosis, and can focus in on the fact that you have lupus and what to do about it. So you can have the next slide, please. So how do we deal with this challenge of diagnosing lupus? And this diagnosis relies on a careful and detailed history, examination, and test results. So one of the most important things that can happen is there's a lot of listening and storytelling between the provider and the patient. It's really important for you to not only talk about your current complaints and things that are bothering you, but also what happened in the past. Because remember, things can happen at different points in time, and we need all those pieces of the puzzle in order to put the puzzle together. You should keep a list of things that are happening, so you are empowered to have this very important conversation with the healthcare provider. But not only is the provider asking you about your history, but also asking about your family. And as was mentioned in the previous talk, that sometimes other family members have lupus or other autoimmune diseases, and those are important clues that the provider is going to use to try to put together that puzzle. They will also do a general body review of systems, not only to see if other areas might have been affected by lupus, but other conditions that you might be at risk for that would also need management. Then the provider is going to focus on the physical exam, looking for things that might be related to lupus or other conditions. And then based on all of that information, we'll decide on appropriate tests. This could include tests of your urine, tissue biopsies or samples from your skin or your kidney to see if those areas are inflamed, imaging tests to look at internally what's going on inside of your body that we might not be able to find on the physical exam, and then also some blood tests. And there are some specific blood tests that will be ordered for you if that diagnosis of lupus is being considered. The most common test that you might have heard about is called the anti-nuclear antibody test, or the ANA test. So even if this test is positive, it doesn't mean you have a diagnosis of lupus, because some of those other autoimmune diseases that I talked about could also have a positive, make you have a positive test. Or if one of your family members has an autoimmune disease, you could have that positive test. But it is a clue, and an important clue for your provider, because then they're going to order other tests. Other antibody tests include anti-double-stranded DNA antibody and this extractable nuclear antigen panel, which looks at other antibodies, and phospholipid antibody tests, because in lupus, you're more likely to make more than one antibody, and the more we find, the more information that supports the diagnosis. In addition, we look at other proteins in your body, and this would include these serum complement levels. And what's important here is if is a level elevated or lower, and your provider needs to know which direction is the signal that it might be lupus when they're ordering all of these tests. So as you can see, a lot of detective work is needed to put all these clues together and direct the next steps. Next slide, please. So now you have a diagnosis of lupus. So you need a treatment plan that needs to be developed for you as an individual. And the first thing that the provider is going to look at are what kinds of medications do you need specifically for your lupus? And these are sort of the general categories of medications that would be considered for a lupus patient. Anti-malaria pills are sort of the cornerstone of a lot of treatment plans for individuals who have lupus. A common anti-malaria medication is called hydroxychloroquine. And this medication, or its cousins, which are less likely to be readily available, so we will mostly focus on hydroxychloroquine, helps control the disease. It can prevent flares. It means that you would likely have less damage to your organs if you have had inflammation, and there is an improved outcome, so you're less likely to die from lupus. So many lupus patients are on this form of medication as long as there are no side effects or problems taking it. The next category of medications are nonsteroidal anti-inflammatory drugs, or NSAIDs. Some of these are available over the counter, and higher doses of them are available by prescription. These are generally used to manage pain, which is a very prominent problem that lupus patients have. The next category of medications are corticosteroids. Sometimes they are referred just as their nickname, steroids or glucocorticoids. And some of the common medications that you might be prescribed in this family would be prednisone or prednisolone. And these medications can be given as pills, directly into your vein, a shot into a muscle, or actually put as a cream on your skin. So there are very many different ways that this medication can be used. It's frequently used at the beginning of the lupus diagnosis symptoms, once they're recognized, to get quick control of those symptoms, or later on when you're having a flare. People feel a lot better with these medicines in the short run, but they do have a lot of side effects. So the challenge here is to use it just when it's necessary, but make sure that you use as little as possible over the course of your disease. And then the provider might decide to add other medications, including immunosuppressants or biologic agents, which are basically to tame your immune system to not be so active. Immunosuppressants have been developed for many other diseases, and we borrowed some of them to treat for lupus. And it would be the provider's judgment in order to help you select which one is right for you. And then the newer category of medications, which is very exciting for those of us who treat lupus patients, or biologic agents, as there are two new medications that have just recently been approved. Well, one not so recently, 2011, and another one within the last year or so, that were specifically designed to combat some of the lupus treatments. So with shared decision-making with your provider, they will go over these categories of medications and decide which one is right for you. They should go over what they think the anticipated benefit is and what are the side effects. So with this shared decision-making, this plan can be started and then adjusted as time moves on. Next slide, please. So not only is your provider going to be thinking about lupus-specific medication, since lupus affects the whole body, we also need to be aware of other potential comorbidities or other areas of illness where you might have increased risk. And there are three categories that I'd just like to highlight now, and that would be cardiovascular health, bone health, and your emotional well-being. It's not unusual when you get the diagnosis of lupus to be depressed or anxious or be uncertain in terms of how you feel about this from the emotional standpoint. So if we look at cardiovascular health first, there are medications to control blood pressure, lipid levels, and blood sugar. A lot of the medicines that we use to treat lupus can make some of these conditions more of a problem. So it's very important to look at these areas and see if you need additional medications to keep these parameters in a normal range. You would also need to watch your weight and your diet and blood sugar, because we don't want you to get diabetes. And unfortunately, one of the side effects of those corticosteroids, which are used all the time in lupus, if we continue to use that at high doses, we put you at risk for this problem as well. Lastly, with respect to cardiovascular health, it's really important to stop smoking. Smoking increases your risk of cardiovascular health, and it's very important for lupus patients because it makes those anti-malaria drugs less effective. So for all of these reasons, these other areas might be addressed as part of cardiovascular health, either in conjunction with your primary care provider or another specialist, which we'll talk about in one of the later slides. Because this is such an important area, we want to emphasize it again, which is to limit the steroid exposure. And in this case, the most common form of that would be prednisone whenever possible. This is particularly important not only for cardiovascular health, but also for bone health. And there are several other things that we would recommend, which would be to make sure you take calcium and vitamin D to support stronger bones. And then also try to work out some program where you can be more physically active. And that can be challenging if you have pain or you're tired. And so some individual counseling may be necessary to see what you can do, because actually something is better than nothing. And lastly, when we focus on emotional well-being, meditation, talk therapy, or even sometimes medications may help you from the emotional standpoint deal with this disease and the challenges it presents to you. Next slide, please. Oh, thank you. So now we'll also talk about lifestyle approaches. Again, this is to empower you to take charge when you may feel like you're not in control because you just got this new diagnosis or you're getting a flare. Some things we've talked about already, and there are a few additional things that I'd like to emphasize. So first, we would suggest try to move. Some type of physical activity, you will definitely feel better. Our patient experts, and as well as my patients and all of us who provide care, everybody asks us, what is the diet that I should use for lupus? And there are some indications from other studies that eating a healthy diet and maintaining your weight are important. And some examples are the anti-inflammatory diet or a kidney-friendly diet. We can talk some more in detail about that if you have questions about diet. We talked a little bit about managing your emotional health, so stress management and meditation techniques are very helpful. One area that we have not specifically talked about, but was mentioned in the previous talk about flares, is sun protection. For some people, exposure to the sun or even the medications they might be taking can precipitate a flare. So it's really important to wear sunscreen and wear a hat and appropriate clothing if you're going to be out in the sun. Even if it's just hot outside, you may want to limit your time outside. And then there are also heat and cold therapy strategies to relieve your pain. Again, stop smoking and consider reducing alcohol intake. Next slide, please. Complementary medicines may also be important. So we've talked about physical activity, but maybe you need some more guidance. Physical or occupational therapy might help with pain relief, flexibility, and mobility. Yoga might help you with managing stress. There's some indication that acupuncture might be helpful for pain. Supplements such as DHEA or dehydroepiandrosterone, been some studies where it helped some people but did cause some side effects. And some supplements related to omega-3 fatty acids might be helpful. Next slide, please. So how do you decide on a treatment plan? This needs to be individualized for you. And so they'll consider your age, your current lifestyle and activity levels, and what you might aspire to. They're going to help you manage your symptoms. We talked briefly in the previous slide about managing your family planning goals. You should talk over your treatment plan, or is the treatment working? How are you dealing with side effects? Do you need a different drug or a different dose of a drug? We talked about a lot of the comorbid conditions to manage your risk factors in addition to your lupus. And unfortunately, the reality is that we do have to deal with health insurance, but your provider can be your advocate in terms of appealing coverage that may be denied for you. All of these things are, many of them are actually directed towards pain and controlling inflammation, because the majority of patients will suffer from these conditions, and particularly chronic pain. I think I have one last slide, which will be a segue into our next talk. Now, we've talked about a lot of things that you need to do in terms of your treatment, so you're going to have to coordinate your lupus care. So in addition to the primary care provider and your rheumatologist, there may be other members of a lupus care team that need to be involved, and you're the captain of your ship. So let's say you need some help with emotional health. You might have a mental health professional. If there are issues related to your heart, you might need to see a heart specialist or a cardiologist. If you have bad headaches or brain fog or seizures, you might need to see a nerve specialist or a neurologist. If there's inflammation in your lungs, you might need to see a lung specialist or a pulmonologist. And lastly, the most common internal organ involvement is the kidney. So you might need to see a nephrologist or a kidney specialist. And these are just some of the people that you may need to work with to coordinate your care. In fact, I have a slide with a patient and myself in the middle, and we have like 20 different kinds of services that might need to be managed. And so with this overview of how to make a diagnosis and those challenges, all the treatment things that you have to think about, and all of the health professionals that you might have to deal with, I'd like to turn this over to our next speaker, who's going to talk to you about how do you manage all of this. Thank you.
Thank you so much, Rosalind. And I just wanted to note before we go on to the next speaker that those who are tuned in live can submit questions at any time using the Q&A function, and we'll try to address as many as we can during the panel discussion portion of the event, which will be coming up after Estela Mata Carcamo, who's going to share insights from her journey into lupus advocacy and tips to support and empower women as they live well with lupus. Thank you, Estela. Yeah.
Thank you. Thank you, Society for Women's Health Research, for inviting me here today. I am, ready to share a couple of things here, a couple of tips. I myself do not live with lupus, but I'm a patient advocate, and I have a sister that lives with lupus. So I am here, just like Dr. Rosalind just shared, you are the captain of your ship. And as my sister says, you are the CEO of your body. So we need to take charge. So I will be going through a couple of slides and tips that can help you feel empowered to take charge of your lupus. So next slide, please. So one of the things that you can do is preparing for your visit. Consider a lot of the things, and you might be at a journey where this is your first time seeing your rheumatologist or your physician. So coming in with a couple of these items will help you help the provider also get to know a little bit more about you. So history of your symptoms, family history as well. If you have any relevant information about treatments you've had in the past, any surgeries, current medications that you are taking, if you have any past diagnoses or anything that you've been diagnosed with, contacts of providers, of physicians that you have seen in the past. If you have medical records as well that you can bring in, whether it's in a file format or just copies of those specific treatments, and contact information is very, very essential. Having a support person to come in with you just in case you forget some of the symptoms or forget some of the things that you wanted to go over with your provider is also well accepted. And I think as long as you contact or you ask your provider if you can bring someone in, most of the time they allow you. I know with COVID restrictions, there was a lot of difficulty, but bringing in some sort of note or someone to help you with the note taking tracking is also very important. Journaling and tracking your symptoms is very, very crucial, especially when you're first diagnosed. Not everyone has the same symptoms. Everyone is very unique. So it is so important for you to kind of journal and track those symptoms that you've been having, how long you've been having them, what you noticed, when you noticed they started, how long have you had these symptoms, and also if anything is triggering them. And the Lupus Care Journal tracking tool that we have at the end of the Living Well with Lupus Toolkit is really made for these things. You know, if you have lupus, you already have been diagnosed, you know, it's very good to be able to track those symptoms, and how it'll help you help the provider get you the treatment that you best need. Next slide. And, you know, preparing to see your provider is one thing, with a listing of all your symptoms and tracking of all your symptoms and your diagnoses and all of that. But another thing to do to prepare for your visits is to write down some of the questions that you may think that you want to address at time. You know, the time with a provider is very limited. So you want to make sure that you are clear with your questions, and you're also getting those questions answered. So making note of those questions is very important. And here are a couple of sample questions that you can, you know, utilize for your next visit. So if you're experiencing a specific new symptom, or you know, more severe symptoms, you know, go ahead and jot that down. You know, I'm experiencing more joint pain during this time, or when I do this activity, or maybe you're experiencing more hair loss or sensitivity to the light. You know, sun exposure was mentioned earlier, but also UV rays from the lights can also be triggering a couple of flares. So if you're experiencing specific symptoms, jot down how long you've had them, how severe they are, if anything is triggering them, and then ask your provider, what can you do to address these things, or what can you do to alleviate these symptoms. As far as medical treatments, you know, it is good to always ask and be prepared to ask, what kind of medical treatment options does your provider have for you? If there are recommendations, like the previous presentations, you know, there are a couple of treatments that are already out there that are FDA approved for lupus and lupus nephritis. So you want to make sure that you come in prepared and ask those questions for those specific treatments. You know, what kind of treatments it is, and what options do you have? Is it infused? Is it going to be oral medication? You know, it is good to come in with those questions already. Also, you know, what are your options when it comes to alternative treatments? Is there something that you can try outside of, you know, the treatments that the provider is giving you? Is there something that you can do outside of that, like acupuncture, like yoga? Are there any specific diets that you can try to help you, you know, kind of like a anti-inflammatory diet, maybe recommendations as to what you should start eating or stop eating? You know, I know one of the things that I've heard is that there's no specific like miracle lupus diet, but as long as you try and eat like more leafy vegetables, and, you know, stay away from the processed meats and processed foods. So since lupus is very unique with everyone, you want to make sure that you ask your provider about what he recommends or she recommends for you. As far as treatment goes, you know, if you are starting a treatment, or if you are going to change a treatment, or currently on a specific treatment, how long are you going to expect to see or experience any symptom relief? And now well, probably you'll see the effects, you know, within 2 weeks, 3 weeks. Some of them may take longer. So these are things that you want to discuss and know, and have this discussion with your provider. So communication is key. So if you have these questions written down, it will help you and help the provider also answer these questions. And I know with lupus, it affects your body in different ways and it affects everyone differently. So how will lupus affect your long-term health? So that's another great question to come in and ask the provider, because like I said, everyone is different and they can assess you individually. Also, another great thing to ask your provider is, talking about your condition with your loved ones, with your caregivers, with your families, with your employers. That's very important because a lot of times some people may need special accommodations for all of this. So it's important for you to, ask the provider to see if they can help you with these tools. Next slide. And seeking support. So a lot of times, if your provider does have local support groups within your area that you can, maybe reach out to, that would be very beneficial, because seeking support is one thing, but actually engaging others to support you and your health can help you, one, get your diagnosis sooner, not only that, but also feel a lot better. And these tools that you can get from providers, like the toolkit that we're talking about today, this is a great way to kind of, talk about what the symptoms are without really you having to do all the talking. You can share this toolkit. Consider also connecting with other women that have lupus. Support groups are a great way to do this. Not only will you be able to learn from others that have been living with these conditions, but also you can share what has worked for you. Again, everyone is so unique. So it's always good to be able to, hear from others, and also not only feel empowered, but have someone understand what you're going through. Another thing that I've seen a lot is not only this social support or this family support, but also trained professionals that can support your overall health. So lupus can impact not just your physical well-being, but also your mind. So you can, feel depressed, maybe you're feeling anxious, maybe it's just you're not feeling well at that, you're feeling depressed or something like that. So you might want to get someone other than just your support group to help you with this. So when those cases come up, do seek training, trained professionals for this, licensed clinical therapists, psychologists, counselors. These are all great ways for you to be able to communicate with and see how they can help you manage your health. And also, let's not forget about the caregivers and loved ones. We also have a journey together with our loved one that's living with this condition. If there's a caregiver, we also encourage caregivers to take care of yourself, because if you are feeling overwhelmed, you are not going to be able to help that loved one that you're caring for. Kind of like in the airplane, they always tell you, if there's an emergency, right, you get the oxygen mask and you put it on yourself first before the other person. That's exactly what we must do. You cannot pour from an empty cup. So you must also empower yourself to take care of your body and yourself, both your emotional and your physical health, to be able to care for someone else. Next slide. So advocating for yourself and advocating for a loved one is so very important. And I will tell you a couple of shared experiences that I have. Self-advocacy is something that you must do for yourself. My sister is alive today because she advocated for herself. So utilizing your voice is very important. Communicating with a provider, making sure that the provider understands what your needs are, making sure that you are communicating with them and sharing that decision about what treatments are working for you, what is not working for you. Remember, you are the CEO of your bodies. You know what is best for you. You know what you're feeling you know what has been working, and you know if you are going to be able to do what the treatments or adhere to the treatments that the provider is requiring of you. So communication is very, very important because that provider relationship is key. Feel empowered not only to share about your symptoms, to talk about deciding what treatments are best for you, but also to be able to change providers if your provider is not, you don't feel like you're being heard, or maybe you don't think it's the right relationship for you. Maybe you can seek another provider. So know that you have the ability to do that as well. Knowing your rights, you as a patient have the rights, have patients' rights. So let's call this as kind of like the patient's bill of rights, right? Know what your coverage issues are, know that the provider can help you with treatments, know that that you can appeal those rejections, and more importantly, you can meet with your representatives if there are any policies that are impacting your care. Next slide, please. Advocating for accommodations, whether it's using your voice at the doctor's office or sharing this with your at school or at your workplace, know that you are able and have the right to ask and advocate for yourself, whether it's the lighting that's affecting your flares, whether it's, maybe less of a caseload that you have to do, maybe less hours, maybe taking breaks, maybe having, if you're going to school, having someone take notes for you, or someone accessing you some transportation from and to a classroom. Those are different things that you can do to advocate for yourselves, and making accommodations for work. Remember, not every disability is visible, so you speaking out is very, very important. And next slide, please. Self-care and lifestyle management. Again, I think we kind of covered a little bit of this, but eating healthy, make well choices for yourself, not smoking, reducing the stress, because stress triggers flares. So making sure that you utilize, other methods like mindfulness, yoga, art therapy, meditations, getting that support for the emotional wellness, support groups, and also your trained professionals. And don't forget to always, always track your symptoms, because that's what's going to help you help the provider. And next slide, please. I think that may have been the last slide, and that wraps my session up. Thank you.
Thank you, Estella. We have received a couple questions in the chat. For those of you who are joining live, again, you can submit your questions using the Q&A function. It's usually at the bottom of your screen. We will try to address as many individual questions and common themes as we can in the next few minutes before we close at the end of the hour. I invite the panel to open up their videos. Yes, I see everybody's video is on. And so one of the things that came up, we know lupus is an invisible disease. It has, and I know it was mentioned that over time, it can kind of show itself in the diagnostic process. But what about, you hear the term remission that's kind of thrown out there. And so I know individuals are always looking forward to seeing, how can I beat this? How can I cure this? Or, achieve a remission? What does that look like for someone who has lupus? And is that possible in this autoimmune space?
Remission is possible for people with lupus. Now, it turns out that the numbers of people that go into remission at any given time is not as high as we'd like it to be. Somewhere around 10 to 20%. So while the numbers are not high, as the medications that we have are getting better, we hope that we're going to be able to achieve that for a lot more people. Now, for cancer, remission means you're done with the treatment, you're done with going back to the doctor. Well, as of right now, we think of remission in lupus, remission where you can be off the medications and you're going to be fine, but there's also remission where you need to continue your medications. And that, because of where we are in how we manage lupus, seems more realistic. So yes, we'd all want everybody to be in remission without any medications, but until that's possible, we need to think about, putting people in remission while they need to continue to take their medications.
I would add that it would be important to outline your goals with your provider. And so the first goal would be, how can I manage my disease? It may seem overwhelming at the beginning because there's a lot of medicine and a lot of rules about how to take them and other things you can and can't do. And then once you start feeling better, the doctor is confident by measuring different tests and the exam that they think you're on the journey to needing less medication. That would be the second goal. And yes, of course, we would love it if every blood test was normal and you didn't need any medication, but we know that there's no cure for lupus. And at this point, we can't do a test or a panel of tests that would say you're going to flare in next month, so I can restart your medicine now. So we still have a lot of work to do as researchers, but we would definitely share the goal. We would love to increase that percentage of people who we can say, have a true remission. We can't find any footprints of the disease and you don't need any medication. That's a relatively small number right now, but a goal, an aspirational goal that we hope to meet for you as the patient.
So I think that that's a really important point in trying to be realistic about the goals. And also, I think it's important to stress the fact that taking care of your lupus is about a partnership. It's a partnership with your doctor. It's a partnership with your healthcare team. So it's really important to think about this as a long-term plan. It would be wonderful if we had the cure, and I think that it's been very clearly stated that we don't have the cure. So until that time comes when the cure is available, having a realistic plan and making sure that that's achievable. Because if you're really sick and all you can think of is remission, then you might be very disappointed when your doctors can't deliver that. So making that plan realistic by partnering with your doctor and understanding what's possible for the next month, for the next 6 months, for the next year is critical. And my kids used to say when they were young that how do you eat an elephant is one piece at a time. Kind of think as lupus in the same way. It's a big, gigantic elephant, just one piece at a time.
And I'd just like to bring up what Estella talked about. Lupus doesn't affect just you, but everybody around you. So you need a supportive environment at home. And so this is a big job that you have, in terms of making sure that your support team, however that works for you, is on the same page. It's hard enough dealing with lupus alone, but it's, I hate to use the word easier, but it's more manageable if you have everybody involved.
I really like the approach of, and sometimes we forget because all we're thinking about is, I just want to get to the end of the cure, and it's stepwise goals that, you can rally around your healthcare provider, your support network, and see what's the first step. Let's either get the flare in control, and then we can look at, reducing or titrating medications. Then we can look at, this. And so it is a stepwise process. And I really like how you kind of laid that out. We get patients, I'm looking at the time, and we do want to be mindful of that. And we get patients, general audiences, researchers, healthcare providers, industry, and even some policy makers that tune into our events. And so I want to ask each of you as we wrap up, what is a takeaway that you would recommend to a particular audience that I might have mentioned, or broad to our viewers, to help them support women living with lupus, either from if it's a family member, how can they do it? If it's on the policy end, if it's from the medical perspective, what piece of advice would you like to offer from your experience, something to those that are tuning in? And so we'll start with Rosalind, then Anka, and then Estella will end with you.
Well, I'm not sure I could pick one thing, but I would say knowledge and communication and listening, because you can't get any of those other groups, all of them, if they don't know about lupus. And many people will say, what is that? And until they get an idea of what lupus is and how it can affect you, even if you look fine, that's the other part that's difficult. You look okay, but you don't feel well. They have to understand how it affects you internally in all of the ways that we discussed. So knowledge sharing, effective communication, and support are what's necessary.
So just to follow up on all of these, words of wisdom that have been said today. So I tell people that it takes a village to take care of lupus. And I think that it takes a village in terms of the support that people need. It takes a village in terms of the doctors. It takes a village in terms of the advocacy groups, in terms of the policymakers. So I think that our lupus village is getting stronger every day, but we need a village to achieve what we need to achieve and make lupus a curable disease.
And I would say communication, partnership, and collaboration. I think at the center of it all is the patient. And if the patient has communication and trust in partnership with a provider, and they're able to utilize their voice to get the best treatment that they can, I think that would be a win for the patient community. So I think collaboration, support, and communication and partnerships.
Thank you so much. And you actually touched on that trust factor, because from what I'm hearing and what I know of lupus, there's going to be ups and downs, and being able to weather that means I trust my provider that even if something doesn't work, we've made this decision. They've heard my concerns. They've taken the time to address them. And even if it doesn't work, I know that I can trust them moving forward with another option, another path. And so I think that is very important. There is a huge burden of self-advocacy on women and women living with chronic conditions like lupus, but finding there are really good doctors out there and healthcare providers, and finding one that's good for you, because that is important. So thank you so much to you guys. Have been an amazing panel. Thank you for your time, the insights you shared as well. And we thank you to Eli Lilly and Company and Aurinia Pharmaceuticals for their support of this event and SWHR's lupus program. Again, we could not do this work without the expertise and contributions of our science networks, particularly the lupus working group members who contributed toward the development of SWHR's Living Well with Lupus, a toolkit for women. We will send out an email with a recording of today's webinar to all registrants, as well as post the recording on the event's webpage for future viewing. So please be on the lookout for that and feel free to share with others. To all our viewers, live and recorded, we invite you to connect with us on social media and visit our website, www.swhr.org, to register for future events, download additional women's health resources, and sign up for our newsletter. Let's continue this very important conversation with hashtag SWHR Talks Lupus. Thank you for joining us.